Welcome to Get Set Up. So what do you need to know about collecting Social Security as it relates to Medicare coverage? Let's talk about that in today's segment. If you are someone that is collecting Social Security payments prior to age 65, and you have been doing so for 4 months or more, you are going to be one of the people that are automatically enrolled into Medicare coverage. That means a few months before you turn 65 years old, you're going to receive your red, white, and blue Medicare card showing your Part A and Part B effective date on that card. Now, does that mean you need to keep Medicare coverage? Don't forget that Medicare Part B coverage comes with a price tag. You will pay a premium for that coverage. If you do not need that coverage, you do not need to be paying for that coverage. So it's really important to understand whether you need Medicare or not. One of the biggest things you can do for yourself, the biggest positive related to Medicare, is find out if you need Medicare at 65 years old. I will warn you that many people that are on Social Security that are collecting that money prior to age 65, again, they're automatically enrolled. Their Medicare card comes in the mail. They don't even pay attention. They put it in a drawer someplace. They don't even realize they have Medicare. All of a sudden, the government is taking a premium every single month from your check, and many people don't realize it. So number one, know if you have Medicare. Number two, make sure you need Medicare. If you need Medicare, then that's fine. You just let everything go as is, and then you'll be getting with an insurance agent or broker typically, or a SHIP counselor, to decide what kind of coverage you want to go with your Medicare. Now that you have A and B, because you're automatically enrolled, you'll want to decide if you need a Medigap plan and a drug plan, or do you want a Medicare Advantage plan. Now, let's say you're collecting Social Security, but your spouse is working and you happen to have your insurance coverage through your spouse. In that case, as long as that spouse's employer has over 20 employees, you do not need Medicare. Don't accidentally put your card in a drawer and forget about it, because you're going to be paying for coverage that you very likely don't need. But let's say you're on your spouse's insurance coverage, but let's say it's costing your spouse $800 a month to keep you on that plan. Well, now that you have this new Medicare card, maybe Medicare's a better and less expensive option for you. So always compare cost and coverage to what you have available to you. When you turn 65, it just means you have another option available to you. It does not mean you have to take Medicare if you have employer coverage elsewhere. It means it's an option. So sometimes people will choose the private Medicare option versus the employer plan. But you want to be cognizant of comparing the cost and coverage of those things. Now let's talk about people that are not collecting Social Security, and then they do sign up for Medicare. So something to know about this is that when you sign up for Medicare but you're not collecting Social Security, you're just going to get a bill in the mail for your Medicare premiums. So this confuses people. Well, how do I pay my premium? You're going to get a bill in the mail. And then you have a couple of options. You can go online to your Medicare.gov portal. You can pay with a credit card with no fee. You can set it up for easy pay. What that means is you can set the payment up to come out of your checking account each month if you so choose. At some point after having Medicare, you will start collecting Social Security typically. At that point, your Medicare premiums will be deducted from your monthly Social Security check. No need to pay a bill or look in the mail for bills. Be aware also that with Social Security, as long as you're collecting Social Security benefits, you are able to have deducted from that amount Medicare Part D premiums and Medicare Advantage premiums if you have any. And that would be in addition to your monthly Part B premium that you're paying to Medicare. So again, those are some things to just realize about Social Security, how it interacts with Medicare and premiums, just so you're cognizant of who is paying what. Join us and Get Set Up for other Medicare classes.